All this out, it feels really good. All that. Like if I just do this, I don't really feel it that much. It's when I go like this and really pull through this whole area right here.
And that feels good.
Yeah. But then, like I said, I think that aggravates it after a while. And then when I do this, I go up like this, and if I go to this side, that doesn't hurt. But when I go to this side, this feels really good because it's stretching all that out right here. All this. And then when I do these, that really pinches that area right here. That hurts a lot.
The practice that we're doing is geared more towards your low back and your hip and your SI. So you want to focus on structural alignment, and we'll do a standing pose where you're just standing and working isometrically to externally rotate your right hip so that you start to work some of that misalignment back into place. And we'll be doing poses to increase circulation, which is what we always want to do first so that the muscles will be more agreeable to opening. And then we'll strengthen and stabilize around your SI joint. And we'll also have some poses in the beginning to bring circulation all the way down to your feet. So that should help with your knee and ankle pain. And I'll give you guidance as we go through this. Okay? Thank you. Okay, now you can gently set one foot down and then the other, always moving one leg at a time to protect your low back. And now we're going to do a twist, but we want to make it symmetrical because I think the one-legged twist that you were doing was probably aggravating the SI joint. And we want to keep your knees hip-width apart. So you can use a folded towel or we have a block. Sherry's going to put a block between her knees. And then with an inhale, bring your knees up into your chest. Arms will go out to the side. And as you exhale, let the knees go over to the right, and you're going to gently look to the left. And I'm going to have you pause there. And you're going to stay here for 9 breaths. I'm choosing not to have you move in and out of the twist because I just want you to focus on letting the relaxation happen. You can work that left shoulder towards the floor. And this is a good place to really work your core, pulling the belly in, pubic bone all the way to rib cage. And then as you inhale, softening the belly from the top down. And Connie, if this twist isn't comfortable, you could even place a blanket under your right knee so that your right knee is sinking into that if it's not touching the floor comfortably. Now we want to protect your low back coming out of this. So oftentimes it will feel better if you bring your knee up towards your elbow. So you can bring your knees towards that right elbow and then with an inhale come back to the center. You can pause there for a moment, maybe even hug the knees into the chest. Doing a forward bend brings your low back to neutral. So when in doubt, hug your knees to your chest. And when you're ready, you're going to take the arms back out to the side, take an inhale, and as you exhale, let your knees go to the left, and then you can look towards the right. And I imagine it feels very different on each side. Regardless, wherever you're feeling the tension or the tightness, you want to imagine that's where your lung is, so that each breath that comes in is bringing light and space into that area that's tight. Then when you're ready to come out, you're going to bring the knees a little bit up towards that elbow, and with an inhale, come back up. Hug the knees in. You can set your block to the side. And Connie, always feel that to work towards symmetry, if there's a big imbalance, you can stretch the tight side, stretch the other side, and then go back and stretch the tight side again to work towards symmetry.